The newsday continues here on One News Now. I'm Riza Diaz. The spike in new cases is a nightmarish situation, pushing our hospitals to their critical limit. That's according to Professor Guido David of the OCTA Research Group. In an interview with the chiefs, David suggests to treat everybody we meet as potential carriers of the virus as precaution against COVID-19.
This is a nightmare happening to us right now. Ang tingin ko ngayon, just to be on the safe side, I would treat everyone I encounter as potentially having the virus and act accordingly. I mean, I think that's the safest way.
David also adds that this surge is much worse than last year's, with the health department on Friday logging the highest number of new cases in a single day.
3,779 in NCR alone. I mean, this is really going to hit our, our worst nightmare. Yung projections natin, we could be seeing 4,000 cases per day right now by next week in NCR. This is unprecedented. We haven't seen this kind of surge in NCR.
David also laments the situation of hospitals right now, with most NCR hospitals soon to reach critical levels, especially in the much-needed ICUs.
Actually, mas marami ng hospital occupancy now in terms of beds occupied. It's just that the DOH and the hospitals were able to expand hospital beds and ICU beds. Dinagdagan nila, nadagdagan nila, na-scale up, right. So, yung in terms of percentage, mas mababa ngayon. But in terms of the raw number, mas mataas na ngayon. And that shows na talagang this is a surge that's worse than last year because mas marami nang nasa hospital, especially sa ICUs. The best ICUs are in Metro Manila, and pag napuno na yun, where will they get admitted?
As new COVID-19 infections reach an all-time high, can hospitals still cope with the rising cases? To answer this, we have Health Professionals Alliance Against COVID-19 member, Dr. Maricar Limpin. Doc, good afternoon.
Yes, good afternoon to everyone.
Doc Maricar, how are hospitals doing, especially now with these numbers?
Definitely, we are trying to cope up with the increased numbers. I think we see that despite the increase in the numbers, we are still not in full capacity, pero big number of the hospitals have already reached the critical level, no? So, the reason why now that we are still able to cope up is because we have also increased the capacity of the hospitals. So, we have improved our facilities, we have improved our bed capacity, we have increased the number of beds in the ICU. But we are also merely reaching this maximum capacity. So I hope that people will really, adhere to the minimum health protocol. And we hope that the LGUs, especially the local chief executives, yung mga mayors natin, I hope that you listen to us kasi we are trying to hold the fort, but we are afraid, of course now, we are afraid that baka yung holding the fort might no longer last, no? So baka hindi na namin kayanin in the end, and we will be sending patients away. And that is something that we cannot bear to think, sending patients away just because we cannot accommodate them anymore.
Doc, how are our healthcare workers? Kamusta po sila? They're not still calling for a timeout.
Yes, because we are trying to do our best, no? Although I think we are already feeling a little bit tired. I can sense that, but nobody is really saying it. But there is really a sense na parang pagod na talaga yung mga tao, no? But I think because we know already what to do, parang ang feeling namin, kakayanin pa rin namin. And as much as possible, of course, we are not calling for a time out yet because we are trying to cope up with the current situation that we are in now. But we are just praying that this will not continue, no? Because if it continues, then definitely there's no other way except to really call for a timeout if the need arises.
Doc Maricar, what should the government do, in your opinion, to address the surge in cases?
Well, the granular lockdown will be very helpful, but very important is the restriction in the movement, no? Ang medyo natatakot kami yung darating na Holy Week, no? Because with the Holy Week, baka people will start going to these resorts, no? And then, unfortunately, baka pagpunta nila doon, iba-iba ang requirements ng bawat LGU. So, we are hoping that there will be a unified requirement for each and everyone. Kung ang isang probinsya magre-require ng RT-PCR, sana lahat magre-require ng RT-PCR, no? Na negative. And even if coming back to Manila, kasi sometimes they get it from the province and then when they come back to Manila, they already are positive. So the more that we will be burdened with higher increase of COVID cases in Metro Manila. Alam naman natin that the biggest burden of COVID-19 is here in NCR. So I just hope that we will be able to cooperate with one another, lalo-lalo na po yung mga local chief executive. We keep on harping this. And also with the business community. I hope that we know you do not want to close down your workplaces anymore, but I hope that you will reconsider the staggered working schedule, no? So that not all people will be going out at the same time. And para sa ganon, hindi ma-decongest natin yung mga public transportation natin. And also, we can also decongest yung mga elevators na gagamitin natin going to our workplace and also the streets, no? We can also decongest that if we can only apply staggered cases, staggered hours. That is, if they will not implement also mga 3 days or 3-day reporting to work, and then maybe the rest of the week work from home na lang muna tayo, no? If that can be done. So I don't know, no? This will really require help from everybody, cooperation from everybody, and I cannot help but overemphasize the need to do this. Because we cannot contain this if we will only be the ones working. We are already putting our lives down, no? We are risking our lives so that we can assure that all Filipinos who will come to us will be taken care of. But sana po, wag naman po yung dumating sa punto na marami din sa amin ang namamatay. We just recently, we had one healthcare worker and nurse who just died. So, ang hirap, no? Ang bigat-bigat po para sa amin. And we know the reason kung bakit sila nagkasakit because we are taking care of patients with COVID-19. Kung hindi nare-realize ito ng ibang tao na hindi nagkakasakit, we just hope that they will listen to us because we are the ones seeing these patients and we are also the ones taking care of them. And we, in the end, are the ones who will be affected.
Doc, by the end of March, OCTA research is projecting that the numbers will increase around 10,000 cases on a daily. What will be your recommendation? Should we go on, let's say, a stricter quarantine classification like ECQ or MECQ?
Well, if it will come to that point, I don't think that we will be able to carry on with what we are doing right now. So I guess the best thing that the government can do is really to have a stricter community quarantine measure. So an ECQ perhaps would be necessary.
Doc,
But,
how about... yes, Doc,
yes.
go ahead.
No, I was actually thinking that I heard the rumor that they are going to have some kind of lockdown in the next 2 weeks. starting Monday. Is this true?
Doc, the proposed circuit breaker lockdowns perhaps is what you're talking about. We would like
Yes,
to know your
right,
thoughts
right.
about this.
Yes, I think that will be the case, no? If they call it as a circuit breaker, then by all means, yes, because that can help contain the transmission of the infection. But the circuit breaker still allows, no, a lot of movement. So I hope that they will really restrict the movement.
Oh, we surely hope the numbers get better. Maraming salamat po sa inyong oras. Thank you for joining us, Dr. Maricar Limpin of HPAAC. And those are the top stories of the hour. Join us later again at 1 in the afternoon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.